The national policy debate on health care really has taken a series of directions, and right up to today's news and today's Wall Street Journal, you can read about health care, the Democrats and the Republicans, the compromises that they're trying to reach, and they have reached a compromise in terms of setting a limit on how many dollars will be spent on this entire process. And of course, that was one of the big talking issues. So as they come together piece by piece and begin looking at what health reform really can cost and what they're willing to pass this year, we are going to see some major changes for a couple of reasons, not the least of which is the entire House of Representatives is up for election this year, and not the least of which is as we come into the fall season, many of the constituencies are going to be asking the Senate, what have you done in not just health care, but also in welfare reform and insurance reform and all these issues, and you can't change one without changing the other. So there's a lot of momentum continuing to build. One of the confusions that I see in Washington, D.C. when I visit there quite often, and also in terms of talking with physicians, is the confusion between managed care and managed competition. That is, a lot of people are focusing in on managed care as being the change, and it certainly is a mover of change, if you will. But managed care focuses on how physicians and hospitals really deliver their care in a different way. That's what managed care was intended to do, and that's what its focus has been. Managed competition, on the other hand, really focuses more on how the purchasers, the employers, in some cases the health plans, how they actually are going to have to change as a direct result of the health reform and a lot of the legislation going on. So although they are two separate issues, they're intertwined, but oftentimes people confuse them and interplace them, saying, oh yeah, that's that managed care stuff they're talking about in Washington. Well, managed care has been around for an awful long time. Managed competition, however, is really going to change a lot of the rules as we know it. Let me